तुम्ही पाहताय एबीपी माझा. हळदीनं युक्त असलेले अनेक आयुर्वेदिक उपचार आपण आजवर घेतलेत, मात्र आता हळदीनं संपन्न असलेली जेली चॉकलेट बाजारामध्ये उपलब्ध झालेत. पाहूया त्याच संदर्भात एक रिपोर्ट.
अतिशय छान, म्हणजे ह्याच्यापासून दातांना कीड पण लागण्याची शक्यता फारच कमी होईल आणि हिरड्याचे सगळे रोग आटोक्यात येतील आणि होणार सुद्धा नाही. आणि ह्याचा जर का नियमित वापर केला तर मला वाटतं आपण डेंटिस्टला बघायची पण गरज नाही.
It can be useful into preventive caries format. It is a known product to India and Ayurveda. It will be a best product to promote as a preventive product against the dental caries and periodontitis.
After using it in our patients, we found that Dennkur is very useful in patients who are suffering from chronic intraoral lesions. Maybe just some periodontitis, or also those who are suffering from the white lesions of the mouth. Besides all these wonderful scientific facts about the wonderful behavior of turmeric, what is really very important is the way this particular medicament has been packaged and is ready for you and for me to consume it. What makes it really interesting, besides all the other factors, is that it tastes really good.
The most preventive product for the next generation.
The modern medicine or allopathy doesn't have a solution for a lot of chronic problems. Those are the situations we have to go back to the more established Ayurvedic therapies and remedies. We may sometimes call as the grandmom's suggestions. Curcumin happens to be one of that product, and we've tried in some of these chronic situations related to the aphthous ulcers or the lesions on the buccal mucosa, tongue, etc., and they have been known to give relief to the patients over a period of at least 15 to 20 days. They do come and say that at least they're feeling definitely better. We need to see the long-term effect, but yes, it is worth trying at this point of time, and I would certainly recommend that.
It's very happy feeling to share with you my experience with Dennkur. I was lucky to know about the product about 9 months back, and now being into freelance practice, I have more exposure to a lot of patients. With that, I could use it for 2 patients with advanced lichen planus with severe stomatitis, and a number of geriatric patients with poor oral hygiene and chronic periodontitis. Most of these patients reported excellent results.
What is it? It's curcumin. What is curcumin? Nothing but curcumina longa or regular haldi, or which is also known as turmeric. The minute someone talks about turmeric, I think the first thing that comes to our mind is a smile on our face and a little bit of as the old memories where the grandmother would run after us with a glass of milk with a dash of turmeric on it whenever we have suffered with sore throat. And we have very religiously avoided taking this particular product, not forgetting the fact that we tend to use it in the regular day-to-day cooking that is carried out in our own kitchens. When it comes to turmeric or curcumina longa or curcumin, it is available today in the form of pastilles. And I would like to congratulate Dr. N.K. Doctor for having thought of this wonderful product and giving it to our own patients. What does it do? It brings down the antibacterial activity. It acts as an antiseptic. It can be given to our patients post-operatively in cases of dental infection. By this, we can definitely reduce the use of antibiotics and other analgesics and anti-inflammatory. The ill effects or the side effects of these medications can be clearly avoided. In the years to come, I would definitely love to see this particular product used in different forms and different methods or different modes of treatment. For example, in the form of sealers in root canals, or maybe in some form or the other in cases of dry sockets.
I had a chance to try this new medication called Dennkur into my patients in last 3 months. I've been seeing these patients with the recurrent desquamative lesions for over 2 to 3 years. thought let's give a try with this new medication, which is primarily a very concentrated form of curcumin. Basically, it's like a highly concentrated form of a haldi extract, which we know is a very potent antiseptic and an anti-inflammatory agent. But since this medication wouldn't have given any adverse reactions or adverse effects, thought of giving it a try with this particular medication once, okay, for these two particular patients. I was actually amazed to see the tissue response over 6 to 8 weeks after putting them on Dennkur. I had not noticed so much of remission of the lesions in these two particular mouths with the palliative and steroid-based intermittent therapy which we had been doing for them for last couple years.
Dennkur is of course made up of haldi or curcumin, as we say, and all of you know the special properties of haldi, that is antiseptic or antibacterial and anti-inflammatory. Now this new Dennkur, which has come in a pastilles form, is really a breakthrough and a very effective help, and anything which helps us in our armamentarium, apart from the clinical work, we need a lot of oral medication. Now Dennkur, as I have started using it and have found it's an excellent for all kinds of inflammatory, which is gingival or periodontal inflammatory, or ulcerative and other conditions which involve say tongue or cheek or the inside of the lips and all that. Naturally, when there is anti-inflammatory effect and the antibacterial effect, even the conditions like bleeding gums and all that also go down. I found it to be helpful even in patients who are taking treatment of oral cancer and they always face problems of dry mouth and all that. About the way of application or way of using Dennkur is the pastilles are put sublingually or in the side of the cheek, allowing the saliva to work on it, dissolve in it, and which may take about 15 to 20 minutes. And that saliva which goes into the mouth in between the teeth, it works wonders. So it's a very breakthrough product which has come into the market.
Well, I've used this product Dennkur in some of my cases after flap surgery, and there are remarkable results after that. I could see a lot of pain relief post-operatively, and the healing is very much faster. The period of 1 week when we remove the sutures, 7 to 8 days, initially what I found was in 3 to 4 days the healing was absolutely good and the patient was much comfortable post-operatively. As you know that in lichen planus, patients complain of severe burning pain at times, there are intermittent episodes of that. So I tried Dennkur in one of my patients and the patient said that it was much relieved after using this. On the second day, the burning pain was totally gone. I had a few cases of aphthous ulcers, patients complaining of severe pain because of the ulcers, and I prescribed them Dennkur thrice a day for 5 days. And they told me on the second day that they are feeling much comfortable. I think it's working.
Now, haldi or curcumin, what they talk about, turmeric, in other words, the molecule is curcumin, is basically what happens is it disintegrates, it gets destroyed by 80 or 85% once you swallow it. And the coughin which was available for cough, you swallowed it and 80%, and even that 15% was effective. Can you imagine a product which does not disintegrate? Well, let's talk about it. We are talking about curcumin. It's in the form of some sort of, they call it pustules or lozenges, etc. And this curcumin, you suck it 3 times a day. As such, they are marketing it only for the oral cavity. In my opinion, any mucous membrane, whether you've got a nasal infection which can absorb, where there are fluids, washed with fluids, in any orifice, there are 3 major orifices in the body, and that they have not yet started manufacturing in India.
Dennkur, that is a tablet, which is a gelatin tablet, which is used as an 100% curcumin, as having antiseptic, analgesics, and anti-inflammatory effective against these premalignant lesions. And obviously, for the local application, this is one of the type of the drug as an adjuvant therapy and a primary therapy for the treatment of the premalignant lesions.
We have been lucky enough to use Dennkur for few of our patients having lichen planus, oral ulcers, post-perio treatment, etc. It has also been helpful in post-extraction pain management.